Afternoon or good morning, everybody, depending on what time you're watching this. Today we're going to discuss inventory management. So we're going to go through the basics of inventory, special handling, returned medications, how to handle drug shortages and product recalls, and then we're going to summarize it all up. Starting with our objectives, after this lecture, the student should be able to understand procedures as they relate to the purchasing, storing, handling, disposing, and returning of medications, identify medications that require special handling, and define laws and regulations that relate to the handling of inventory. So starting with the basics, inventory management is essential for both the business side of pharmacy, but also ensuring that patients receive their medications in a timely, safe fashion. Inventory management always starts with the purchasing of the inventory and typically ends with the expiration or disposal of the inventory. So it's impossible for a pharmacy to be profitable without good inventory management practices. It is absolutely essential to ensure there is an adequate stock of medications and supplies to serve patients and personnel. So some of the goals of good inventory management practice include minimizing out-of-stock medications to better patient care, decreasing carrying costs of maintaining an inventory that's too large, lowering the cost of ordering medications from wholesalers, minimizing the time spent ordering medications, preventing inventory expiration, and purchasing products at the lowest cost available. With that being said, it's important that we understand some of the things around ordering drugs. So first, we're going to discuss NDC numbers. NDC stands for National Drug Code, and every drug has a unique NDC number. They're 10 numbers long and divided into 3 segments. So this 11-digit number identifies the manufacturer, product, and package size. If the manufacturer of 2 medications are the same, they will have the same first 5 digits. If a medication is the same but comes in 2 different package sizes, the center 4 digits will be the same. Finally, the final 2 digits are used to identify the package size. So as you reorder medications, you can order the same size package using the NDC code. So if you ordered 500 capsules last time and you know you need 500 capsules again, you can utilize that NDC code to ensure you get the same size package next time. So we have a few examples of NDC codes here. At the top, you see a normal NDC code with 1, 2, 3, 4, 5 being the manufacturer identifier, 1, 2, 3, 4 being the product identifier, and 1, 2 being the product size identifier. In the second example, you'll notice that there's only 4 digits in the first 5. In this scenario, the manufacturer identifier is actually 0, 1, 2, 3, 4. Anytime you only have 4 digits in the first section, you should assume the first digit is 0. Same thing for the third example. You see that there are 3 digits rather than 4 in the center. The product identifier is actually 0, 1, 2, 3 for this one. Anytime you only have 3 digits in the middle section, assume that the first digit is 0 as well. Likewise, for the last example, we only have 1 for our product size identifier, but the identifier is actually 0, 1. Anytime you only have 1 digit in the final section, you should assume that the first digit is actually 0. Different from NDC numbers is lot numbers. This number is a unique identifier that's assigned to a specific batch of medication by the manufacturer when they make it. So the lot number is used in the event of a recall in which the manufacturer needs to notify both pharmacies as well as patients of potentially dangerous or contaminated batches of medications. So anytime a medication is removed from its packaging, such as compounding, unit dose packaging, or automated dispensing systems, the lot number should still be recorded in the event of a potential recall. Now to discuss the difference between wholesalers versus manufacturers. A manufacturer makes the medications, whereas a wholesaler distributes the medications. Wholesalers distribute medications to pharmacies from a large list of manufacturers. Some large companies deal in such volume that they have their own warehouses where they store and source a tremendous amount of medications, only using wholesalers between delivery times. Most independent pharmacies, on the other hand, use wholesalers 99% of the time. Should there be a back order, you may find yourself having to contact the manufacturer directly. If that happens, definitely expect delays as well as shipping charges. So it's always easier to go through the wholesaler. So when you're ordering from a wholesaler, it generally takes place on the computer through an online ordering system. The system consists of a list of all of the medications that can be ordered, including the drug's name, item number, and package size. So some wholesalers, and I would say more often than not, they offer the use of their online ordering system within the actual pharmacy. So this allows all of the pharmacy staff, including you as a technician, to see exactly what is in stock and the quantity available, as well as gives pharmacies the ability to see a more detailed description of the product. This includes the package size, so how many may be in the package, as well as pictures of the item. Many pharmacies use the sticker method to order, so when a drug is needed or the bottle's going empty, the sticker that's on the bottle that was placed there by the wholesaler is removed and set aside. So at the end of the day, all of the stickers are compiled, and then you can place an order based off of the stickers you needed. So now let's talk how to order like a pro. Ordering medications generally gets tricky during certain seasons. So fall and winter, you definitely see more flu shots, antivirals because of the flu, and antibiotics. They're all in high demand, versus spring, you have allergy medications that are in high demand. So you should increase PAR levels in these medications early in the season, but also remember to lower the PAR levels as the season subsides. Also, many computer systems create automatic orders for you. It's good practice to verify what the computer is trying to order before the order is sent out, just to ensure they're not ordering too little or too much stock. Many pharmacies also have agreements in place with their wholesalers to order the cheapest available product should there be an equivalent available. Occasionally, a patient will request that a certain medication be a certain brand, so in that case, you have to make sure that you click the Do Not Substitute box when ordering to ensure that you receive the correct brand versus the cheapest brand. Now we're going to discuss back orders. From time to time, for some reason or another, medications will be unavailable from your wholesaler. So this is terribly frustrating. You are going to get in the habit of telling a patient that you can have a medication ready for them once your order arrives, but then the order arrives and the medication's on back order, so it makes it seem as if you didn't tell the patient the truth. Unfortunately, there is very little that can be done in this situation. You're going to need to attempt locating the medication from another supplier or the manufacturer, but if you're unsuccessful, make sure you contact the patient and let them know the situation. Don't leave them hanging. So some medications are deemed fast movers, meaning you use a lot of them in a given period of time. Some medications are there just for 1 or 2 patients. Because of this, it's also important to only purchase the necessary amount to get the job done. You don't want to over-purchase something that you rarely use, just as you don't want to under-purchase something that you use all the time. No two pharmacies dispense the same medications month in and month out. A lot of things affect this, including the proximity to doctors, what season it is, how remote your pharmacy location is, and even the income of your area will determine what medications you frequently dispense. On the other hand, other medications may not be used often at all. These medications may be ordered just in time. This means the pharmacy will only order the medication when the patient needs it to reduce the cost of having the medication sitting on their shelf. This could definitely be problematic if the patient waits to call their refill in. There could be a lapse between them running out of the medication and the medication being shipped from the wholesaler, causing the patient not to have medicine for a few days. So once you receive medications after you've ordered them, you want to verify the quantity of totes or boxes and make sure that they match the manifest from the courier. Check for any tempering or damage to the totes of medications. If there is any tampering or damage, or if there's an out-of-date item, make sure that you notify the wholesaler immediately and don't touch the product until you have confirmation. Each product shipped should be matched with the invoice to ensure that the wholesaler did not make a mistake, so this could be particularly costly if it seems as if they never send extra, but they do occasionally forget to include an item from time to time. Refrigerated and frozen items such as insulin and vaccines should be checked in and put away first, just to make sure that they do not go bad at room temperature. Chemotherapy medications should be shipped separately, and PPE should be worn when unpackaging. We talk about PPE more in the compounding chapter, but that's personal protective equipment such as gloves, eye goggles, and a gown. Always put items with the shortest expiration dates towards the front of the pharmacy's shelves. That way they all get used first and they do not expire. So now that you've received the medications, we're going to talk a little bit about the difference between an invoice and a purchase order. A purchase order is the list of drugs that the pharmacy intends to order from the wholesaler, whereas an invoice is a list of goods that has been delivered to the pharmacy, itemized with the total cost. The difference between the purchase order and the invoice is usually due to back-ordered items. So the purchase order is what you want to get, it's the order you place, whereas the invoice is what you actually get. So now that you've received your stock and you've compared it to the invoice, it's time to organize your stock. Some pharmacies organize medications alphabetically by the medication name on the bottle. So similar branded generic products may not be located next to each other. This would be if lisinopril was next to lithium because they both start with L, but it would not be near its brand name Zestril because that starts with a Z. So they'd be separated because it's alphabetical order. Other pharmacies organize medications alphabetically by brand name with the generic next to the brand name product. So in this situation, Prilosec and omeprazole would be placed next to each other since omeprazole is the generic for Prilosec. Organization can also be done alphagenerically where all of the products are organized in alphabetical order by the generic name. So this is kind of reversed from the second one that we saw. In this case, Crestor would be found under R because its generic name is rosuvastatin. So now we'll talk about perpetual inventory systems. These are a method of recording the quantity of a particular medication continuously as prescriptions are filled. So this is a continuous monitoring of how much stock we have. After a medication is filled, the quantity of that medication is removed from inventory and an accurate on-hand balance is available. Orders from your wholesaler and returns to your reverse distributor are also recorded. So with this being said, this is basically a continuous monitoring of your stock. Like I said, anytime you fill a prescription for a medication, it's going to deduct it from the stock. Also, anytime you receive an order with that medication, it's going to add it to the stock. Or if you send a return to your reverse distributor, which we're going to talk about in a little bit, that's going to pull it from the stock as well. So you should have an accurate on-hand count. There are also computerized perpetual inventory systems. These are the best method of utilizing a perpetual inventory system is when it's integrated with the pharmacy's software. Inventory is automatically deducted when filled. Barcode scanning allows for accurate selection of manufacturers, and orders can be generated based on the present minimums or par levels. That is to say, if you would like your pharmacy to keep 300 amoxicillin 500 milligram capsules in stock, you would set a par level at 300 capsules. Once your inventory detected that you had less than that, it would populate them on a suggested order manifest. So while it may seem like a maintenance-free means of inventory management, it's important to verify that the count in the computer is actually the count physically on hand every so often, especially because counting errors do happen. For other medications, many pharmacies have their technicians check a few shelves every few weeks progressively so that each item is verified every 2 to 3 months. You may also use automatic dispensing systems in the community to manage your inventory. They're sometimes called a robot, and these systems are used to dispense and label medications. Pharmacy technicians must refill these machines regularly under the supervision of a pharmacist. So think of this as repackaging. A log must be kept of all of the medications that are put into the machine, including the expiration dates and lot numbers, just in case that there's a recall. There are also automatic dispensing systems in hospitals. So these devices allow for medication to be stored on the specific floor of a hospital to ensure that nurses and other providers do not have to come all the way to the pharmacy for every dose. In this situation, the pharmacy technician pulls the medication off of the pharmacy shelves, arranges the medications as requested from the machine, and has the pharmacist check the medications. After receiving a check from the pharmacist, the pharmacy technician will visit the specific floor with the machine, log in, and fill the machine per the request. An error here can definitely be fatal. If the technician were to fill the machine with a medication different from what was requested, the error will eventually be passed on to the patient. So this is a super important one, that whatever you're putting in the machines that's up on the floor is accurate, because once the nurse grabs it and gives it to the patient, you can't take it back. So as a means to reduce errors, once the nurse removes a medication from the cart or automatic dispensing machine, a barcode scanner is used to scan the packaging on the medication and then the patient's bracelet. This is another example of an automated check in the process just to reduce errors that could have happened during the inventory process. So we've talked a lot about inventory and how to handle inventory and the organization of inventory, but what do we do if we have too much inventory? Check with your wholesaler regarding the compensation your pharmacy will receive should you return an item to them. Many have specific rules on returning medications. So as of right now, Smith Drug Company has the following rules. Returns within 6 months of ordering will receive 100% of invoice cost returned. Returns after 6 months since ordering and with 6 months or more left until their expiration date get 80% of the invoice cost returned. And no returns will be accepted on medications with less than 6 months remaining until their expiration date. So if you do have excess stock on your shelf, there is a way to get money back for them. Just make sure you know your wholesaler's policies. You can also use a reverse distributor. So reverse distributors take back expired and overstock medications. First, you'll populate an online form with the quantity, NDC, lot number, and expiration dates of the medications that you intend to return. Next, you'll print a couple of packing slips, save one for the pharmacy records, and put the other one with the shipment that you're sending back. Then you'll print the shipping label, box all of those entered medications, include the packing slip, close the package, attach the appropriate shipping label to the outside of the box, and send it on its way. So there are some items that are not eligible for return. So care must be used to ensure that medications are not endangering the environment or anyone who may come in contact with the product in the garbage. So many medications may be discarded without the pharmacy with the pharmacy garbage. They should not be poured down the sink or flushed down the toilet to avoid water contamination. Medications that are cytotoxic, such as chemotherapy, should be discarded in hazardous waste bins, which are typically yellow or black. Medications with needles should be thrown away in a sharps bin, which are typically red. Now to look at what we do with expired medications. All medications have an expiration date. If they do not, you are to assume that they expire 3 years from the date that you received it. Medications need to be taken off of the shelf in advance to avoid giving a patient a medication that is expired or will expire within their day supply. So say it's December right now, and a patient gets a 3-month supply of a medication, and the medication is going to expire in February, we can't dispense that medication to the patient because it's going to expire before they would run out of medication. A good practice is removing medications 3 months before they expire so that prescriptions with a 90-day supply will not be inadvertently dispensed. Some medications are inherently short-dated. Epinephrine, for instance, if you were to order more than you will dispense, the pharmacy would lose the cost of the excess because it's so short-dated. So most wholesalers will allow you to return expired medications within a certain time frame. If the wholesaler will not accept the outdated medications, you could utilize a reverse distributor for the expired medications like we just talked about. Expired compounded medications are not eligible for return to either a wholesaler or reverse distributor and should be disposed of or destroyed based on your pharmacy's standard operating procedures or SOPs. Now that we've tackled the basics, we're going to dive into the special handling of some medications, such as refrigerated and frozen medications, chemotherapy, investigational drugs, drugs that are part of REMS programs, and controlled substances. So some medications do have special handling requirements based on their safety or stability. It's important that you understand which medications require special handling in order to keep both you and your patients safe. Starting with refrigerated and frozen medications, medications that are to be stored in the refrigerator or the freezer will be shipped separately from other room temperature medications, typically in an iced cooler. These medications may include vaccines as well as insulin. They should be checked in first so that they can be promptly put into where they're supposed to be to ensure that they remain safe. So you want to get them to a cold temperature immediately as soon as you get that inventory in so that they don't start to go bad. Refrigerated medications should be stored between 36 and 46 degrees Fahrenheit, while frozen medications should be stored below 5 degrees Fahrenheit. Temperatures should be checked twice daily and recorded on a temperature log to ensure drug stability. If a medication is left out of the refrigerator or freezer for an extended period of time, Make sure you check the package insert, or you can call the manufacturer to determine if the medication is still safe to dispense. This happens a lot with insulin. You'll pull an insulin out of the fridge, you'll get it together, you'll get it ready for a patient, and then it ends up sitting out for a while and the patient doesn't come get it, and you have to call the manufacturer to see if you're eligible to continue using that insulin and dispense it for another person, or if you now have to get rid of that insulin. Never store personal food or drinks in the same pharmacy refrigerator where all the medications are. Moving on to chemotherapy. Similar to refrigerated and frozen medications, chemotherapy is going to be shipped separately as well as put away before other non-hazardous medications. Make sure you're following your pharmacy's SOPs when unpackaging hazardous medications. This may include the donning of PPE and unpackaging medications in a designated area. Be familiar with your pharmacy's MSDS or Material Safety Data Sheet location so that you may reference them to understand any special precautions or hazards as it relates to drugs you are unpackaging. Now, investigational drugs. Some pharmacies, especially in inpatient hospitals, will receive investigational drugs for the purpose of clinical trials. These medications may be unpackaged like all other medications, but the invoices for these medications must be kept separate from other invoices. You may have to document the receiving, dispensing, and returning of investigational drugs in a logbook based on your institution's SOPs or your state's law. So just be aware if you're dealing with investigational drugs, what rules and regulations come with those. Now we'll discuss the handling of medications that are a part of a REMS program. REMS, or Risk Evaluation and Mitigation Strategies, are drug programs that help to ensure the safe use of medications for various reasons. In these medications, the risk of using the medication may potentially outweigh the benefit of using that medication, which is why it's super important that these patients are closely monitored. Some REMS programs simply ask that pharmacists and prescribers become certified before giving the medication, whereas other REMS programs require that labs be done regularly just to ensure the safety of the medication and the patient's not getting hurt. So you can reference the document Restricted Drug Distribution Programs for more information on specific REMS program. We've included that in the chapter for you. We're going to move on to ordering controlled substances. Anytime a pharmacy orders a Schedule II or C2 medication, that pharmacy must complete a DEA 222 form. Many computerized ordering systems now allow you to fill this form out online for submission with the order from the wholesaler. This form has to be kept for a minimum of 2 years after the date that the medication was ordered. Once you receive your controlled substances, you're going to want to package them separately from all other non-controlled medications. They're going to come packaged separately from all non-controlled medications. Only pharmacists should be checking in the controlled substances, so immediately consult your pharmacist upon arrival. As a pharmacy technician, you can help your pharmacist by verifying that you received the correct amount of each controlled substances and bringing it to your pharmacist's attention if you notice any discrepancies in the controlled substances you receive. When storing controlled substances, Schedule C3 through C5 medications can be stored on the pharmacy shelves with the remainder of the non-controlled medications, but C2 medications must be stored in a safe vault or some other form of locking mechanism separate from other non-controlled medications. Be familiar with your state laws as it relates to controlled substance storage, as every law is different in the amount of safety that they require C2 medications to have, as well as C3 through C5 medications. Similarly, taking inventory of controlled substances, a pharmacy should complete an initial inventory of all controlled substances on hand on the day that the business plans to start dispensing medications. So the day that the pharmacy opens, they need to take an initial inventory of every controlled substance they have. After that, an inventory of all controlled substances should be taken at least every 2 years. If a medication becomes controlled through a law or regulation change, the pharmacy should take an inventory of the newly controlled medication on the day that the medication becomes controlled, and then can be included in the biennial inventory thereafter. We saw this recently when gabapentin became a control. We went ahead and had to inventory all of the medication we had on hand before it became a control. That way, the day that it became a control, we had an inventory ready to go. Federal law does require that C2s be managed utilizing a perpetual inventory system like we discussed earlier. So for C2 medications, an on-hand count is typically done at least once a month to verify the quantity in the computer as well as to prevent any loss or theft. So you need to have that perpetual inventory system going for every dispensing, every time you receive a C2, anytime you return one, so that you have an accurate count. But you should also be doing an on-hand count by hand at least once a month, just to ensure that your perpetual inventory system amount is correct. And then here we have the same information that we had previously about computerized perpetual inventory systems, just to reinforce it, that it is generally recommended to complete an annual inventory for all medications. And like I said, have your technicians or you as a technician check the shelves every few weeks, so that by every 2 or 3 months you've progressively checked all of the inventory again. There's also a DEA Form 41 for controlled substances. If your reverse distributor will not accept a controlled substance, the DEA needs to be notified that the drug is to be destroyed by the pharmacy. So DEA Form 41 should be used to request permission to destroy controlled substances and must be completed at least 2 weeks before the destruction of the controlled substances. Once permission is granted, the pharmacy may destroy the drug products for which permission has been given. So if your reverse distributor will not take back a controlled substance, they will not take back an expired controlled substance, you can use this to be able to destroy it yourself. Destructions of medications must also comply with local, state, and federal environmental regulations. Care must be exercised when throwing away medications. The completed DEA Form 41 must be maintained at the pharmacy for at least 2 years, similar to the 222 form that we discussed. Finally, we're going to touch on the loss and theft of controlled substances. Should you believe that there's been a loss or a theft of a controlled substance, make sure you notify your pharmacist immediately. Upon discovery of a loss or theft, the pharmacist must promptly fill out a DEA Form 106 and report it within 1 business day. The DEA uses NDC codes to track the manufacturer, product, dosage form, and package size associated with common losses and thefts. Like other forms, this form should be kept for a minimum of 2 years. So now looking at drug shortages. Drug shortages are one of the most common reasons that a medication may be backordered. Drug shortages can arise for any number of reasons. Common reasons include an increase in the use of a medication, so we saw this with hydroxychloroquine during COVID-19, or an insufficient supply of an ingredient for a medication. Should a drug shortage arise, notify your pharmacist so that they may reach out to the appropriate patients and prescribers to prevent a lapse in medication for the patient. The FDA also has a website that lists what medications are currently in shortage, as well as the status of the drug shortage. You may also come across drug recalls. The FDA requires that any medication that has an error that would prevent the medication from meeting the guidelines of the FDA or the manufacturer be recalled by the manufacturer. Manufacturers may also induce voluntary recalls for minor issues if instances such as inconsistency with drug manufacturing occurred. Drug recalls are divided into 3 classes. So class 1 are going to be medications are recalled because they may cause serious harm or potential death. Those are your more serious recalls. Class 2 are recalled because they can cause temporary or reversible health effects and are at a low risk of causing serious harm. Finally, Class 3, these medications are unlikely to have any health consequences, but rather have an issue with labeling, defects in the container, or an abnormal color or odor. So when this happens, your pharmacy is going to receive a notification from the manufacturer or the wholesaler informing you of what medications are being recalled. This message will include the name of the drug, the expiration date, and the lot number, as well as the reason for the recall and how to return the medication. The FDA also has a website dedicated to reporting current product recalls. As a pharmacy technician, you should definitely assist your pharmacist in pulling all of the recalled medications from stock and sending them back to the manufacturer or wholesaler as they indicated. In the event of a serious recall, you should review the computer software with the pharmacist to find any patients that may have received that batch of medication and attempt to not only notify the patient, but recover any untaken medication that the patient may still have. So sometimes medications never get picked up when we dispense them. It's very, very common for this to happen for varying reasons. Remember that by the time a prescription is ready to be picked up, the insurance has already been billed. So when an insurance company is billed for a prescription that a patient has not received, it could definitely be considered insurance fraud. If the insurance company is a federally funded program such as Medicare or Medicaid, it could be considered an even greater violation of the law. Most pharmacies have policies that require prescriptions to be restocked 7 to 14 days after they were initially filled. Many pharmacies have automatic reports that print daily that notifies you as a technician of which prescriptions have been waiting for pickup for too long and need to be returned to stock. Sometimes patients are also going to bring medications back to the pharmacy to you. In those situations, the patients no longer need the medication. The medication should not be placed back in stock as they've already left the pharmacy and definitely could have been tampered with. You want to follow your pharmacy's standard operating procedures for the disposal of any returned medications that have already left the pharmacy. So in summary, pharmacy technicians play a critical role in the handling of pharmacy inventory. Inventory management involves the ordering, receiving, storing, and disposing of many different medications, just to name a few tasks. Practicing good inventory management will help to ensure that the pharmacy remains profitable, patients remain safe, and all laws are enforced. Inventory management is an unsung task of pharmacy technicians. A lot of times pharmacy technicians are the people that are put in charge of handling inventory management. You're going to be doing the ordering of medications, the restocking of medications. A lot of times you're unpacking the inventory once it comes in. So really having a good grasp of this idea of not keeping too much inventory on the shelves, but also not keeping too little, is essential to helping the pharmacy run a very profitable experience, but also providing the patients a really good experience